Here we are going to look at the fractures as well as the fractures and dislocations, as well as the associated nerve injuries. So to get started with the questions, the first question is, in case of the supracondylar fracture, what are the nerves which are injured? And it will be even better if you know the priority of the damage. Second question is, the nerves involved in the or damaged in the posterior dislocation, and this is of the elbow. Third question is, in case of the wrist injury, what is the damage to the nerves? So by the end of this video, you will know all the answers to these questions, and in the end there are some bonus questions as well. So to get started, the first we are looking at the fracture of the clavicle. So the fracture of the clavicle, it involves the brachial. It involves a brachial plexus. Next, we look at the anterior as well as the inferior shoulder, anterior as well as inferior shoulder dislocation. So this, it involves the axillary. It involves the axillary. That is nothing but the circumflex humeral, circumflex humeral nerve. Next, we look at the proximal humeral fracture. So this will be the symbol for the fracture we'll be using on from now on. So the proximal humeral fracture, it results in the injury to the axillary nerve. Then moving on to the shaft. So moving on to the shaft of the humerus. Shaft of the humerus fracture. So this involves nothing but the radial nerve. Then moving on to the supracondylar. The supracondylar. So the supracondylar fracture, and this is of the humerus. So what are the nerves injured? So in the supracondylar fracture of the humerus, what we see is there is involvement of the anterior interosseous nerve. So it is the first priority, and after that there is the involvement of the median nerve, and post that there is also the radial nerve. Next, we look at the medial condyle of the humerus. So the medial condyle of the humerus. So this medial condyle of the humerus, the nerve injured in the medial condyle of the humerus is the nothing but the ulnar nerve. Next, we look at the posterior dislocation of the elbow. So posterior dislocation of the elbow. So what is the nerve involved here? The nerve involved here in the posterior dislocation is nothing but the ulnar nerve greater than the median nerve. Post this, we are looking at the Monteggia fracture. So the Monteggia fracture, it involves the pin. So what is meant by the pin? It is nothing but the posterior interosseous nerve. And post this, we are looking at the Walkman. The Walkman ischemic contracture. So the Walkman ischemic contracture, it involves the AIN. AIN stands for the anterior interosseous nerve. So after all this, we are going to look at the hook, the hook of Hammett, hook of Hammett fracture. So the hook of Hammett fracture, it results in the deep branch, deep branch of ulnar nerve. So it is nothing but a deep branch of the ulnar nerve. Next, we have the lunate dislocation. So what does the lunate dislocation result in? It results in the injury to the median nerve. Then we move on to the wrist injury. So what does the wrist injury deal with? It deals with the injury to the median nerve. And looking at the posterior hip dislocation. The posterior hip dislocation, it deals with the sciatic, deals with the sciatic nerve. And we also look at, next we look at the anterior dislocation of the hip, as well as the shaft of femur fracture. So all this, it leads to the femoral nerve injury. Then moving on, we look at in case of the knee dislocation. So in terms of the knee being dislocated. In the knee dislocation, what do we have? We have the common peroneal nerve, and later on we also have the proximal tibial fractures as well as the ankle injury. So the proximal tibial fracture and the ankle injury, it results in the injury to the posterior tibial nerve. Next we look at the fracture to the neck of fibula. What is the fracture of the neck of fibula? It results in the damage to the lateral popliteal nerve, and it is nothing but the common peroneal nerve. So now we'll be answering the questions we asked initially. So first question we asked was, so the answers, first question we asked was, what is the fracture, supracondyle fracture associated with? So there's damage to what are the nerves? The supracondyle fracture, it mainly causes the injury to the AIN, that is anterior interosseous nerve, greater than the median nerve, and this is greater than that of the radial nerve. Next, the second question we asked was, what is involved in the posterior dislocation of the elbow? So in case of the posterior dislocation of the elbow, there is the ulnar nerve, which is greater than the median nerve. Post this, looking at the third one. Third, we asked of, in case of wrist injury, what is the nerve damaged? So it is nothing but the median nerve which is damaged. Now we move on to some bonus questions which can be answered in the comments. So the first question here we want to ask is, what are the nerves involved in case of the knee dislocation? What are the nerves damaged? The second question is, in terms of the Monteggia fracture, what are the nerves involved? The third question is, in case of the Volkmann ischemic contracture. So in this case, what are the nerves involved? So these answers can be put in the comment section.